All right, so welcome back to our series of lectures regarding the anatomy of the heart. And here specifically we're going to discuss the internal features of the heart. And as we said, it has 4 chambers. So what are the internal features that are found in these 4 chambers? So we have seen the 2 are superior and 2 are inferior. The superior one are called atria, or in singular we call the atrium. And then the inferior one are called ventricles. So you have left and right atrium, and then you have the left and right ventricle. All right, so let's go and see the internal features. But again, this atria, externally, you can see an ear-like structure called the auricle, which is the pouch-like structure showing the external feature of the atrium. So we have the left auricle and the right auricle. So what are the auricle? These are the auricle. So this is the left auricle and this is the right auricle, and this tells you this is the right atrium and this is the left atrium. Okay, so internal features. If you dissect the atria, you will see some of the features here. And let me show you the diagram so you can appreciate these features. So we've just cut at the atrioventricular groove and then reflected the lateral wall of the right atria. So now these are the things that we can see here. For instance, we can see this vertical line ridge-like structure called the crista terminalis. So this is called the crista terminalis. Just lateral to the crista terminalis, on the lateral wall of the right ventricle, the right atria, you see this ridges-like structure, network-like of ridges-like structures again. So these are called the pectinate muscle, or the musculi pectinati. Yeah, so this is the pectinate muscles. But on the medial aspect, or on the interatrial septum, you see some other features here. For instance, this one. This one is called the remnant of foramen ovale, or it is called now because it has a membrane closed again. So the foramen ovale, this was the passage of blood in the uteral life, where the blood from the superior and inferior vena cava entered the left atria through this foramen here. So it is called the foramen ovale. So after you are born, it has to close. And if you heard some people are saying that my child has a hole in the heart, so this is the hole that normally is referred to. But again, in the normal adult heart, you find like a depression called the fossa ovalis. Just above it here, there is a crescent-shaped kind of ridge just above it, which is called the limbus of fossa ovalis. The limbus of fossa ovalis. All right, so this, on the medial aspect, you see the fossa ovalis and the limbus of fossa ovalis. Laterally, you see the musculi pectinati and the crista terminalis. But now see, the limbus of fossa ovalis is derived from the septum secundum. If we discuss, I'll do another session on the embryology of the heart, you will understand what is the septum secundum. We have the septum primum and the other septum, which are found during the embryology of the heart. Now, so the pectinate muscle, we've already seen that. They are found on the primitive, derived from the primitive atria. This is the rough surface of the lateral wall of the atria, left and right. They both have the pectinate muscle. But again, you can see the crista terminalis, which is the internal ridge separating the smooth surface of the wall of the sinus venerum from the rough surface of the masculine pectinati, or the pectinate muscle. But again, I hope you have seen what we call the sulcus. So this, on the external feature, if you look at the heart externally, you will see the ridge, another ridge on the external surface, the sulcus terminalis. I wish I could have an image so you can see, so that you could see this, the sulcus terminalis. So if you look at the posterior aspect of the right atria, you will see this another ridge-like structure corresponding to the crista terminalis called the sulcus terminalis. All right, so that was the features of the right atria. So this is the right atria. On the left atria, again, you see the fossa ovalis, and then you can see a valve-like structure here on this side. So this is the left side. All right, so the features on the ventricles. On the right ventricle, you see this the largest part of the anterior surface of the heart, and then a small portion of it lies on the diaphragmatic surface. But again, the right ventricle covers almost the entire inferior border of the heart. I hope we have already discussed that. But now, if you look at the heart, you find a tapering or a cone kind of shaped surface of the heart. This is called the infundibulum or the conus arteriosus, which leads to the pulmonary trunk. So this area here is the cone-like shaped that leads to the pulmonary trunk. So this is called the infundibulum or conus arteriosus. Alright, so the whole thing here within the dotted line, this is the right ventricle. So if you cut the wall of the right ventricle, what will you see? What will you see? So these are the structures that you can see. Number one is the trabecular corni. So this is the irregular muscular ridges that project from the inner surface of the right ventricle, and of course even on the left ventricle you see the same patterns as well. We have again what we call the supraventricular crest. These are the rounded accentuation of the its muscular wall, demarcating the inflow from the outflow. We are going to see that, but again we are going to see the infundibulum, which is outflow to the pulmonary trunk, which now embryologically it was derived from the bulbous cordis of the heart. But again, you're going to see the thickest part of the right ventricle wall, which is much thinner than that of the left ventricle. So the thickest portion of the right ventricle is thinner than the one of the left ventricle, and this is because of the adaptation, because I hope you know that the left ventricle pumps the blood towards the rest of the part of the body, but the right one pumps only to the lungs. Alright, so let's go and see these kind of things here. So this is the smooth surface leading to the pulmonary trunk, and this is called the conus arteriosus. So what you see, these ones are the valves of the pulmonary, what we call the pulmonary valve. But again, you see these things here. These ones are the muscles attaching the tendons, which attached to these are called the cusps, or the valves, the cardiac valves. So in this case, this is the right atria. It has 3 valves. This is the anterior cusp, this is the septal cusp, and this is the posterior cusp. So these are 3 of them, and that is why it is called the tricuspid valve. Now see, the cusp here are attached to the tendon-like things. They are known as chorda tendinae, and these chorda tendinae, they are attached to the muscle-like structures called the papillary muscle. So these are the papillary muscle which attach the chorda tendinae, and so these are the ones that prevent the cusp from prolapse. So if you cut the chorda tendinae or detach them from the papillary muscle, this cusp can flap backward and then allow the blood to go backward. So these are the ones that prevent that phenomena. But again, on the lateral wall, you will see this kind of features here, the network of ridges as we saw from the atria, but these ones are almost bigger and larger than the one that we saw there, and these are called the trabecular corni. So the trabecular corni, one of the trabecular corni is modified here, and it has even free borders. You can even hook around it, and this is called the septomarginal trabecular, or the moderator band. We are going to see when we are discussing the conduction of electrical conductivity of the heart. You see some of the neuronal bundles, they pass through this moderator band to reach the lateral wall of the right ventricle. Alright, so you have appreciated these things here, the infundibulum or the conus arteriosus. You have seen the papillary muscles, the chorda tendinae, and the cusps here. So on the right side, on the right ventricle, you see the 3 cusps, and on the left atria, you are going to see 2 cusps. So that's why it is called the mitral valve, and this one is called the tricuspid valve. So please be aware and remember the trabecular corni, the moderator band, the papillary muscles, the chorda tendinae, and the conus arteriosus. Alright, so we have seen the tricuspid valves, the chorda tendinae, papillary muscles, and so forth. And then these are another diagram just to cement or remind you what you have just covered. And then, so the septomarginal trabeculi, this or sometimes is regarded as a moderator band, the muscular bundle that traverses from the left ventricle chamber from the inferior part of the interventricular septum to the base of the anterior pulmonary papillary muscles, and then it conducts the right branch of the atrioventricular bundle. We're going to see what is the atrioventricular bundle. That is the part of the conducting system of the heart to the anterior papillary muscle. All right, so that's the moderator band, the septomarginal trabeculi. You can see it from here. This is the septomarginal trabeculi from the septum. It traverses the conducting bands or the bundles of the conducting system of the heart from the atrioventricular septum to the inferior and the anterior walls of the right ventricle. This is another diagram to show you what it is. The septomarginal trabeculi or the moderator band. What are these regions here? The trabecular corni. And what are these ones here? Yes, I hope I've just said the papillary muscles. And this one are chorda tendinae. Thank you. And now this is the cusps, the anterior one, the septal, and the posterior cusp, making the 3 cusps, the so-called the tricuspid valve. If it is on the right side, then you remember you have the mitral valve. But again, you have these other valves here, the so-called the semilunar valves. And these semilunar valves are found in the pulmonary trunk, the so-called the pulmonary valves, and then you have the aortic valves. Now these aortic valves are 3 again, and then even pulmonary trunk, there are 3 of them. We have anterior, right, and left. But in the aorta, you have the posterior, right, and the left. Please remember the cusps in the pulmonary trunk. You have the anterior, left, and right. But on the aortic valve, you have the posterior, right, and left. Let's go and see. So this is the superior view of the cut section of the just above the heart. So you can see some of the atria have been removed here, and then here you can see. So this is the pulmonary trunk, this is the aorta. So now you can see the aortic valves and the pulmonary valve. So in the pulmonary valve, you have this one is anterior. Can you see that? That's anterior. And then you have left and right. So this is the left, this is the right, this is the left. But here on the aorta, you can see you have the right, you have the left and the posterior. So this is posterior cusp, the right and the left. So on the aorta, you have the posterior, left and right. On the pulmonary trunk, you have anterior, left and right. Do you remember these blood vessels? We just said they just found just above the aortic valves, and these are the left coronary artery and the right coronary artery. All right, so thank you very much for up to this point in time. We're almost done with the heart, but there is only one very short and clear portion, the conducting system of the heart. And I wish you can just go through the books, but let me just summarize in short here. So the conduction system of the heart, it is made up of the automatic kind of cells, or what you call the autorhythmic fibers, or these are called the automatic kind of cells which are found within the heart, and these they have ability to self start their action. They do not depend on any neurological intervention, but they start them by themselves. This automatically. So since you are born, those cells, they started working, and then they are the ones that initiate and propagate the conduction system of the heart. Now see, you have two types of cells here in the heart. You have the contractile cells, which now their main function is to pump the blood, and then you have non-contractile cells, or these are the ones that I'm referring to here, the automatic kind of cells, or the autorhythmic cells. So now we have some areas with those cells whereby you will see they are the ones that initiate the conduction of or the pumping patterns of the heart, and they are the one that controls how many times does the heart has to pump the blood in a minute. So you have this area here. If you look at the posterior right atria, almost just below the inlet of the superior vena cava, just medial to it, you're going to see this crescent or elliptical kind of node. This is called the sinoatrial node. So this is where now the action potential, or the pumping of the heart, or the beginning of the pumping of the heart begins. And this is called the pacemaker. If you've had a person having a pacemaker, so there is a synthetic pacemaker that can stimulate and initiate the action potential of the heart. From the sinoatrial node, I hope I've just described the location of it, which is just medial to the inlet of, or the orifice of the superior vena cava. So from there, the bundles are emerging from this sinoatrial node that takes the information from the left atria all the way to the from the right atria all the way to the left atria, and these are called the Bachmann's bundle. So they stimulate the cells in the left atria, and some other from the sinoatrial node they spread out from the sinoatrial node to the walls of the right atria again to excite or stimulate the cells in the right atria to contract. So as the right atria contract, it push blood to the ventricles through the tricuspid valve on the right atria, and through the mitral valves from the left atria. So now see, all this information, all these bundles from the right atria, these are called the internodal bundles. So from the internodal bundles and from the Bachmann's bundle, the information will converge again into and directed to the another node here called the atrioventricular node. So this is called the atrioventricular node. It's just found at the junction between the interatrial septum and the intraventricular septum. So that's why it is called the atrioventricular node. Now, from the information from the sinoatrial node was spread to the left and right atria, and then the action potential was generated, the contraction happened, but again the information will converge into this this node here, the atrioventricular node, and then the action potential will be generated again here and stimulated through this what we call the band of His, or the atrioventricular bundle. So through the band of His, the information of the action potential will be propagated in the ventricular or the interventricular septum, whereby it will divide into two bundles, and these are called the left and right bundle branches. So these are called the this is the left bundle branch, and this is the right bundle branch. So the information which will go on the left side will pass through the left bundle branch, and those which will go to the right one will pass through the right bundle branch. Now the action potential will spread through this left and right bundle branches, and then at the apex of the heart, through the modulator band, the information from the right bundle branch will go on the lateral wall of the right ventricle. And then on the other hand, the information from the left bundle branch will go through the muscles of the left ventricle, and then these bundles here, they branch numerously and several times. Then they will give another name of the bundles here, and this is called the Purkinje fibers. So these are called the Purkinje fibers, which now excite the tissues and cells of the ventricular wall. And in so doing, so information will start from the arterial node, spread to the left atria and the right atria through the Bachmann's bundle and the internodal branch bundles, and then the atrioventricular node will be excited or stimulated again, and then it will propagate the information or the action potential through the bundle of His, and the bundle of His will spread into two bundle branches, and then these bundle branches will propagate information on the lateral wall of the ventricles, left and right, through the Purkinje fibers. So this is another diagram to show the direction of the information. And then so this is another diagram to show you where the atrioventricular node, and then you can see the atrioventricular bundle or the bundle of His, and then you can see the lefty and righty bundle branches. So you can see from this the septomarginal trabeculi, you can see the bundle or the right bundle branch passing there, and then here you see these numerous Purkinje fibers. Alright, so on the left side again, so this is the left bundle branch, giving several branches to excite the walls of the left ventricle, and through the Purkinje fibers you see the network of these excitatory fibers, or the Purkinje fibers, will now excite the cells. So that's why the heart can pump, contract and relax all the time. Alright, so again, this is the homework. You have to go and revise the changes of the heart features and function as the person ages. Having said that, thank you very much for your time.